everyone, it's Dr. Gupta at the Dermatology Laser and Vein Center, and let's talk about preventive Botox because this is a term that you're hearing a lot about in the media. So we'll talk a bit about what Botox is, what it does, and then when should you get it, and should you get it at all, and things like that. So Botox is a neuromodulator, so it is derived from botulism toxin, but it's a medicinal product. So in very small quantities that we use in medicine, it has a benefit and it helps to basically relax muscles that are moving. And it can be used in other applications outside of just making us look younger, but it is also used in medical purposes, such as patients who have maybe contractions, or even inside the body for constrictions, such as in the esophagus and around the GI area. But for our aesthetic purposes, it helps to relax muscles of facial expression. So there are dynamic wrinkles that form because we are contracting certain muscles, such as in the forehead, between the brows, around the eyes, the lower face, and even neck bands and so on. And those can be relaxed using Botox, which basically stops the release of acetylcholine. So then the acetylcholine cannot cause a contraction to that muscle. So it is not a permanent treatment, although when you use it sequentially over some time, it does build muscle memory, or it helps to get rid of muscle memory of making certain expressions. So in that way, I think when you do get it younger, it can help to ward off some of those habits we have of moving our facial muscles in certain ways that causes then static lines to form, or static wrinkles. So static wrinkles form without movement and are present even at rest. And so when you've been making dynamic wrinkles over some time, if you notice that you're at rest and you can still see the lines, then we call those static wrinkles. And when you start to notice those static wrinkles forming, then it's a great idea to definitely go ahead and start the Botox to prevent those lines from getting deeper and deeper with time. So of course, everybody moves their face, even babies frown and make expressions, but their skin is still so supple and healthy, hydrated, and full of collagen that the wrinkles don't become static wrinkles when we're younger. But as we age and we start to lose collagen and our skin isn't as healthy from all the sun exposure and everything else, and also the constant moving and wrinkling of those areas, the wrinkles go from dynamic to being static. All Botox, whether you do it early or later in life, it's always a prevention of those wrinkles from forming and then from those lines getting deeper. Now, there is some confusion. Patients get confused between Botox and fillers. So where Botox relaxes the movement of the muscle, fillers help to fill in the lines. So it's a completely different kind of treatment, and they often go really well hand in hand. So that's a bit about Botox. It is a safe treatment. Usually it will last about 3 to 4 months, and then you can repeat it. Do you need to get Botox? I mean, certainly not. It's a completely voluntary procedure. We do ask that you wear sunscreen so that you don't get skin cancer. But if you're embracing your wrinkles and like them, and certain actors sometimes don't want to lose their expressions, perfectly fine. But it is, of course, available for those who don't want to have it. Personally, I've not had Botox in my forehead, but I'm also not prone to making those types of expressions of raising my eyebrows too frequently or scrunching between in the frown area here to cause a squeezing of those muscles. So that's a little bit about Botox. And if you have any questions, let us know. We're here to help guide you in the right direction and help you age the best you can as we inevitably grow older. But here at the Dermatology Laser and Vein Center, we also always say aging is optional. Thank you so much for watching.